Boa tarde, good evening, bonsoir. My name is Anne-Emanuelle Birn. I'm a professor of global development studies and global health here at the University of Toronto, and I am delighted to welcome you to this evening's John Evans Lectureship in Global Health. Established by David Naylor when he was Dean of Medicine here, the lectureship acknowledges the major role Dr. Evans played in the University of Toronto's late 20th century history and his quote-unquote contributions to advancing health and well-being globally. I must note that this language echoes the mission of the Rockefeller Foundation, which Evans served as chairman in the late 1980s until mid-1990s. Interrogating, if not upending, the role of such dominant global health players is precisely one of the aims of the larger conference designed by our trainees, our project trainees from Brazil, Peru, Germany, and Canada, who are interspersed in the audience this evening, that this lecture anchors. The project is entitled Exploring International Pandemic Responses Through a Social Science Lens, Decolonial Paradigms and Solidarity Networks. I can think of no better person to guide us in this interrogating role than Professor Deisy Ventura. Before my formal introduction, I would like to begin with various acknowledgements. First and foremost, Toronto has been a human gathering site for over 15,000 years. This sacred land is the territory of the Huron-Wendat and Petun First Nations, the Anishinaabe, Haudenosaunee, Seneca, and Mississaugas of the Credit River. This territory was the subject of the Dish with One Spoon Wampum Belt Covenant. I'm thinking about a dish with one spoon that is shared among all, and a coming together of Iroquois and Ojibwe confederacies and other allied nations to peaceably share and care for resources around what we now call the Great Lakes, an approach and a worldview that are needed now more than ever. As settlers, newcomers, refugees, visitors, and Indigenous peoples in Toronto, we have all been invited into this covenant in the spirit of peace, friendship, and respect. Yet as we gather, Indigenous nations, as well as peoples in many places, continue to experience ongoing colonization, extractive violence, and displacement, where land acknowledgements are offered in place of land itself. The University of Toronto itself is complicit in Indigenous dispossession, and I call on all of us to think through the contradictions of being part of this university. I also want to thank our various co-sponsors, the Social Sciences and Humanities Research Council of Canada, the Dalla School of Public Health, the Center for Global Health, and its Institute for Pandemics, the Faculty of Law whose logo didn't quite make it on, but well represented here, and a number of individuals, Erica Di Ruggiero, who heads the center, Amna Chaudhry, Obadiah George, both from the center, who've done an amazing job in coordinating the entire event, as well as local folks at Victoria College here, the tech staff, as well as Princess Famaran and others. And perhaps most importantly, those who harvested, prepared, and are sharing the food that we'll enjoy at the reception afterwards. I can't tell you how thrilled I am to be introducing Professor Deisy Ventura, who heads the Global Health Ethics Unit and is Vice Director of the PhD program in Global Health and Sustainability at the Faculty of Public Health at the University of São Paulo in Brazil. She has a PhD in International Law from the University of Paris I, Panthéon-Sorbonne, and has served as a juridical consultant to Mercosur, the southern region of South America's trade agreements around trade and human rights issues, and to the Inter-American Commission on Human Rights on the COVID-19 response. and is a prestigious research productivity fellow of Brazil's National Council for Scientific and Technological Development, given her national, international research trajectory and profiles, and has served on the Lancet Commission on Synergies between Universal Health Coverage, Health Security, and Health Promotion, as well as co-chairing BMJ's Latin American Advisory Board. Her current research focuses on global health ethics and human rights during international health emergencies, and she is the co-PI or the PI for Brazil of our collective project that we're discussing all week. Now, one hallmark of a fabulous scholar and professor is someone who attracts trainees that are top-notch, committed, critical scholars in their own right, and many of them are among you tonight. I hope you get a chance to have a bit of a chat with them during the reception. But I also want to indicate that Professor Ventura Deisy is one of the most outspoken folks who was kind of a beacon of light, as you'll hear about in her talk, during the pandemic in Brazil under the repressive Bolsonaro regime. And in the tradition of speaking truth to and about power, Professor Ventura, with colleagues here and back in Brazil, penned this extraordinary indictment of the Bolsonaro regime's genocide against indigenous peoples, the elderly in Brazil, and more, as we'll hear about in this lecture. And just one last note for the many students and trainees among us. I always tell my students, beginning from the undergraduate age, those particularly interested in global health, to identify your abilities, hone your expertise, and figure out how you can put your knowledge and skills to use in solidarity with those resisting, as per Sally Schultz, injustice, oppression, and tyranny. Nobody represents this extraordinary ability, right, to find one's skills, international human rights and law, and realize years ago that there was a big missing hole in studies of pandemics, and this is precisely the contribution of Professor Ventura. Welcome.
Good afternoon, everyone. First of all, I'd like to thank Professor Anne-Emanuelle Birn for the opportunity to talk about the Brazilian response to COVID-19 at the University of Toronto, and for introducing me, com palavras tão generosas. Since I began studying global health, your work has been a very important reference for me. I also thank you for the research partnership we have been developing in the realm of the SMAPO project, which has been the most horizontal, challenging, and also the happiest international academic experience I've ever had. I also appreciate very much all the colleagues of the project SMAPO who are present here today. As an introduction, I'd like to reaffirm that pandemics and other public health emergencies are par excellence an issue of human rights anywhere in the world. The study of health crises, such as that of the HIV/AIDS pandemic or the international emergencies declared by World Health Organization, such as the influenza pandemic, the Ebola epidemics, or still the congenital Zika virus syndrome, of which Brazil was the epicenter, easily reveals that crucial human rights issues are at stake before, during, and after health crises. I'm not going to elaborate on them here, but you may see some examples on the slides. It shows that human rights issues go far beyond patient rights, restrictive measures on individual freedoms necessary for containing the spread of diseases, or social rights related to health workers and other essential activities. It encompasses environmental and economic issues that strongly impact people's lives and for which a human rights norm either do not exist specifically or face enormous implementation challenges. This means that biomedical or security-focused approaches to pandemics are not sufficient to contain the spread of disease because they sideline the underlying causes of health crisis. They should also be questioned from an ethical standpoint, as they downplay the devastating effects of this crisis. Therefore, the approach I propose today is a segment of a broader human rights framework that needs to be more comprehensive. It's intended to examine the Brazilian response to the COVID-19 pandemic as a whole. This complex reality has been the subject of extensive scientific literature and many political controversies. Since 2020, I have been advocating for an approach to Brazil's response to COVID-19 that takes into account the pillars of a multidisciplinary field of knowledge and practice known as transitional justice. It stems from the realization that serious human rights violations occurred in Brazil during the COVID-19 pandemic, as I will demonstrate through my presentation. Before proceeding, I would like to explain why I find it important to discuss the Brazilian response to COVID-19, a topic so painful and uncomfortable among many other global health issues I could address. I believe that the prevailing Western thought about COVID-19 is a thought full of forgetfulness. This is how Yanomami shaman Davi Kopenawa defines Western thinking in the book The Falling Sky, originally published in French in 2010, which features his dialogue with Bruce Albert, an ethnologist and his longtime friend. It should be noted that this book is undeniable scientific milestone, as Brazilian anthropologist Eduardo Viveiros de Castro stated. One that might take years to be fully understood by the academic community. To give just one example of this quick forgetfulness in relation to COVID-19, in the document resulting from the recent United Nations Summit of the Future in New York, among the 56 actions proposed by heads of state and government for the future of the planet, there is not a single mention of pandemics or health emergencies. Therefore, I would like to propose an active thought full of memory, as stated by Ailton Krenak, a philosopher, writer, poet, and leader of the Krenak indigenous people. For him, we cannot allow memory to become a privilege for a few, like so many other privileges. I will return to the topics of memory and forgetfulness later on. So, transitional justice, what are I talking about? Beyond the vast academic literature, transitional justice is supported by the United Nations system, enshrined in international human rights law and various national legal frameworks. According to the UN definition, Transitional justice covers the full range of processes and mechanisms associated with society's attempt to come to terms with a legacy of large-scale past conflict, repression, violations, and abuses in order to ensure accountability, serve justice, and achieve reconciliation. The Office of the High Commissioner for Human Rights of the United Nations has a special rapporteur on truth, justice, reparation, and guarantees of non-recurrence. Currently, is the Canadian Bernard Duhem, professor of international law at the University of Quebec in Montreal. The United Nations' role in this matter is quite controversial. Among the most frequent criticism is the goal of reconciliation. In the approach I propose today, I argue that there is no place for reconciliation. Without examining the countless academic controversies about the concept of transitional justice, I would like to highlight some critical elements proposed by the NGO, International Center for Transitional Justice, which is an important reference on this topic. Transitional justice refers to how societies respond to the legacies of massive and serious human rights violations. It asks some of the most difficult questions in law, politics, and the social science, and grapples with innumerable dilemmas. Above all, transitional justice is about the victims. I believe that presenting transitional justice like this adds some important elements to UN system language. The emphasis on difficulties and dilemmas and the focus on the victims. The dimensions of thought and action pointed out as pillars of transitional justice may vary depending on the literature consulted or the international legal instruments in question. In the exercise I propose to you today, I have chosen to speak about memory, truth, justice, reparation, and non-repetition. These dimensions are based on the UN approach to transitional justice, founded on 4 principles of international human rights law that arise from international treaties, the extensive experience of international criminal courts, and regional system of human rights protection. These principles are the obligation of states to investigate and prosecute the perpetrators of alleged human rights and international humanitarian law violations, the right to know the truth about the violations occurred, the right of victims to obtain reparations, and the obligation of states to prevent through various means such atrocities from being repeated. When analyzed the claims of COVID-19 victims and their families, particularly those of the most active associations, the link between their demands and these principles becomes evident. This obligation may be fulfilled in different ways. The most well-known include the creation of truth commissions, memory policies, the prosecution of trials of offenders in national, international, or hybrid courts, the implementation of reparation programs for the harm caused to victims and their families, the promotion of institutional reforms aimed at prevent the repetition of serious violations, including changes to legislation and strengthening of oversight bodies, or the creation of space for mediation and reconciliation between parties in conflicts. According to the United Nations, these initiatives should be inclusive with an emphasis on involving those who may have been frequently left out or marginalized, ethnic, religious minorities, stateless people, women, youth, children, etc. Victim-centered, gender-sensitive, participative, and empowering and transformative for all of society. Latin America, particularly due to the Inter-American human rights system, offers an international recognized contribution on this area. I would strongly recommend the Compendium on Truth, Memory, Justice, and Reparation in Transitional Contexts, published by the Inter-American Commission on Human Rights, which systematized the standards developed during his monitoring work and decisions it has reached cases regarding the rights to truth, justice, and reparation for gross human rights violations during transitions from dictatorships to democratic rule and during peace building and peace consolidation. Among the many examples of the innovations brought about inter-American law in famous cases, which have become a reference in the field of transitional justice, is the recognition of the right of victims to participate in judicial processes related to serious human rights violation. However, every time I present this approach, whether in Brazil or elsewhere, before I even finish my presentation, I hear two objections. The first objection is that the concept of transitional justice implies a change in political regime, which is clearly indicated by the word transition. However, the COVID-19 pandemic may have led to dismissal of some government members, and various electoral defeats can be attributed to the poor performance of governments during a pandemic, etc. But the pandemic did not entail by itself a transition between political regimes. In principle, I agree with this idea. When I refer to a field that studies experience of serious violations as distinct as apartheid in South Africa, the Argentine military dictatorship, the genocide in Rwanda, or the Franco regime in Spain, I'm not proposing a conceptual parallel. Rather, what interests me here is studying the ways to address the serious human rights violations that arose in each of these specific experiences, which constitute both an academic and technical valuable collection. I would dare to call these forms of response, when transposed to the context of a health crisis, social technologies. I need to explain what I mean when I talk about social technology, as it is a polysemic expression widely used in Brazil and is also subject to criticism that I consider quite relevant. In the context of this exercise we are doing today, by social technology, I want to refer simply to three elements. First, a collective construction of initiatives, processes, or policies by social actors who will be affected by these actions, which does not mean the exclusion of the state actors. Second, the dialogue between different forms of knowledge and not just the imposition of technical or scientific knowledge. Third, the existence of a critical perspective in the sense of a horizon for transforming the structural characteristics of societies affected by health crises. Therefore, I am referring here to social technologies that take into account the asymmetric impact of COVID-19 on certain population groups, which cause phenomena like pandemics to generate even greater inequities. However, although this is not my proposal, I would not so quickly dismiss the relevance of this issue of the transition between legal and political regimes in the context of pandemics and other health emergencies. The history of epidemics teaches us that health crises have significant potential to impact political regimes. I hope in the future to have opportunity to develop this parallel on other occasions. For now, what I propose is quite different. It's to learn from the social technologies of transitional justice carried out critically and not idealistically, considering how these ideas and practices can be applied in light of the unique aspects of the COVID-19 pandemic in Brazil. The second objection I often hear is that this approach is not academic or scientific, but either militant or activist. Usually, this objection stems from ignorance about what actually happened in Brazil. Therefore, I would like to start this approach by discussing the right of truth. International law clearly recognizes the right to know about the circumstance of gross violations of victims' human rights and about who was responsible for them. The narratives about what happened in Brazil are very diverse. Brazil was unanimously considered by experts to be one of the most prepared countries for an emergency of this kind. Luiz Henrique Mandetta, the Minister of Health when the pandemic first hit, declared that the Brazilian response would be an example for the world. He was dismissed 3 months later. Brazil's great asset was its public health system, which guarantees free and universal access to healthcare for everyone within its vast territory. It has qualified professionals, experience in network operations, and extensive coverage that ensures a high capacity to replicate protocols in short timeframes, with a tradition of controlling epidemics, including through an international recognized immunization program. However, it's now universally recognized as one of the worst responses worldwide, primarily due to the actions of the federal government and the number of deaths. From the beginning of the pandemic until April 26, 2023, Brazil accumulated 701,000 deaths from COVID-19. By the end of the pandemic, it was the second country with the most deaths from the virus, proportionally accounting for 10% of the reported fatalities caused by the disease. This means that for every 10 COVID-19 related deaths recorded worldwide, 1 occurred in Brazil. For example, on October 8, 2021, when Brazil surpassed 600,000 deaths, had it followed the global average of deaths caused by the disease, it would not have exceeded 130,000. Typically, this catastrophic result is explained by the lack of national coordination in the response, negligence, scientific denialism, or incompetence of the federal government. This is simply not true. The federal government response to COVID-19 was coordinated and efficient. To understand this assertion, we can differentiate 3 dimensions. The first is about communication. The statements made by former President Jair Bolsonaro are well known around the world. Just like Donald Trump in the United States, Bolsonaro's outrageous claims received enormous attention. On the slide, you may see some examples beside an illustration by Brazilian artist Fido Nesti. COVID-19 is a lethal flu. COVID-19 vaccines may raise the chance of contracting AIDS. The best remedy for COVID-19 is contagion. When we reach 60% or 70% infection, the disease will be under control. It takes courage to face the virus like a man. If you act like a coward, you are dead. We must break into field hospitals and film them to show they are not occupied. If you take chloroquine at the onset of symptoms, you have 100% cure. If your doctor does not prescribe chloroquine, change doctors. It's important to understand that such statements were not isolated. They were repeated throughout the entire pandemic and even later on. Technically, we know how detrimental this statement may be, as risk communication during emergencies is crucial for controlling disease whose spread is related to human behavior, such as COVID-19. However, the Brazilian case goes far beyond the use of communication as a means of spreading that disease. The second dimension is behaviors, and perhaps it is less known to the international public. During the pandemic, the then president and other federal authorities personally and directly contributed to the spread of the disease by constantly traveling in a convoy through various regions of Brazil. They systematically attended gatherings of thousands of people, called upon or publicized by the president, even during peak moments of the COVID-19 pandemic, with the complicity of other federal authorities and local disseminating agencies. Many of these gatherings were in opposition to governors and mayors who adopted measures to contain the disease, particularly against the closure of business and the mandatory vaccination. At most of these gatherings, the then president disrespected and incited the public to disregard the measures to contain the disease, going as far as to rip a mask of a child sitting on his lap. He persisted in this action despite being systematically fined by state and municipal governments for violating preventive health measures. Recently, the state of São Paulo, now governed by a political ally of Bolsonaro, Tarcísio de Freitas, granted amnesty for fines related to health violations imposed on the former president, which amounted to over R$1 million. The third dimension, much less known, is the institutional one. There was a federal strategy for the spread of COVID-19. This is not an opinion, and even less so my opinion. These are the objective results of research study that inspired the creation of a Parliament Inquiry Commission at the Senate on COVID-19 and dozens of criminal complaints against government agents. As for our research, it was first published in January 2021 and updated at the request of the Commission, the Inquiry Commission of the Senate in May 2021, both available in English. I was one of the coordinators of the study, along with Professor Rosana Reis, who is present here, and Professor Fernando Cite, Director of the Center for Health Law Research at the University of São Paulo. By monitoring the official Federal Gazette and public statement for federal agents, we found 3 types of evidences. Federal normative acts, including the enactment of rules by federal authorities and bodies and presidential vetoes to bills stemming from Congress. Second, government acts, which comprise acts of systematic obstruction to state and municipal government efforts to respond to the pandemic. Failure to comply with duties outlining in health legislation and omissions related to the management of the pandemic on a federal level. And third, propaganda against public health. Herein defined as the political discourse to employ economic, ideological, and moral arguments, in addition to fake news and technical information without scientific verification, with the purpose of discrediting health authorities, weakening popular adherence to science-based recommendation, and promoting political activism against the public health measures required to contain the spread of COVID-19. A confluence has been verifying between the normative, administrative, and speech aspects of the federal response to the pandemic, which consistency between what was said and what was done. Our study demonstrates the coordinated action of different sectors of the federal government with clear goals. The core of the strategy was the theory of herd or collective immunity by infection or transmission as a response to COVID-19, spreading the belief that the natural immunity resulting from the virus infection would protect individuals and lead to the control of the pandemic, in addition to unfounded estimated of the number of deaths and the end date of the pandemic. By sustaining such a theory, there was the constant encouragement to exposure of the population to the virus and non-compliance with preventive health measures based on denying the seriousness of the disease as an act of courage and supposed existence of an early treatment for COVID-19. The use of chloroquine and ivermectin was a public policy implemented by the Ministry of Health, which persisted even after this medication for COVID-19 were proven ineffective. The deaths and damage caused by the disease were also trivialized, promoting the idea that only elderly people or people with comorbidities or people who did not have access to early treatment would die. The federal government never hid the motivation for that strategy. The president stated dozens of times that the measures of disease containment, which imply the reduction of the economic activity, were a threat to his hold on power. In October 2020, when Brazil counted 120,000 COVID-19 deaths, the leader of the government in the lower chamber, Congressman Ricardo Barros, clearly articulated that motivation during a National Confederation of Industry live broadcast. He said, "We need to end the pandemic." How? Herd immunity. Everyone back to work. Resume the economy and put the state to work. We already have respirators, ICU beds, antivirals. Today, vaccine is yesterday's respirator. Whoever has money will buy it first. we must get on with life. Anyone within the government who opposed this strategy was dismissed, including ministers of health. There were harsh attacks on critics of the federal response, the press and professional journalists who worked to showcase the actual scale of the disease in the country. Scientists and researchers were also fired, persecuted, or threatened. Therefore, an essential aspect of the federal strategy was a systematic obstruction of containment measures promoted by governors and mayors, justified the supposed opposition between health protection and the protection of the economy, which includes spreading the idea that quarantine measures would cause more damage than the virus, and that they, and not the pandemic, would entail hunger and unemployment. It was the Supreme Court in April 2020 that ensured the states and municipalities could adopt measures to contain the disease. The Supreme Court also stated that World Health Organization guidelines should be mandatory in Brazil, but this order was never followed by the federal government. On the contrary, the World Health Organization was heavily criticized. The then president even announced that Brazil would withdraw from the organization following the example of Donald Trump. Members of the federal government at the time agreed, on the contrary, that they took numerous measures in response to the pandemic, such as increasing the number of hospital beds, hiring personnel, and purchasing supplies. As public health specialists, we need to clearly distinguish between a focus on assistance measures for infected individuals and abstention from disease prevention measures. Even so, it's important to highlight that measures related to healthcare were only taken when prompted by other institutions, especially the National Congress and the judiciary branch, including the Federal Court of Accounts. This was the case, for example, of a COVID-19 control plan for indigenous communities mandated by Supreme Court. Many authors propose a theoretical interpretation of what happened in Brazil with several frameworks. Although this is not the focus of my presentation, I must say that this perspective was present in the discourse of the various governmental and social actors who contributed to picturing the pandemic as an expression of natural selection, capable to purifying the human race thanks to survival of the fittest, an ideology commonly described as social Darwinism. Obviously, the reference to Darwinism is a vulgar exploitation of the evolution theory by Charles Darwin, by stream ranging from extreme liberalism to ultra-interventionism, eugenics, having in common the search for the biologization of politics. Widely pervasive in the last decades, it tends to legitimize the staggering social inequalities as though the difference between human beings were due to victory of talent, natural and evil spiritual capacities of individuals, and the sacrifice of the most vulnerable were necessary for the benefit of whole society. The natural selection, which in the past resulted for wars and plagues, would now derive from the current economic competition. In some, social Darwinism and neoliberalism overlap in order to impose a hierarchy of values which prioritize the economy over human life. Therefore, the false argument for the herd immunity by contagion has been called epidemiological neoliberalism. We must still elaborate on this concept, but as a whole, similarly to the unconditional belief in the free market, it implies that the best strategy to tackle the pandemic was to allow into advance without restraints, and just as economic neoliberalism to inflict extreme violence against the most vulnerable, which comprises physical and mental harm and potential after effects and death. When we correlate the SARS-CoV-2 transmission capacity and its mortality rates and lethality, and the population groups it may reach in case there is no contagion in certain countries, we conclude, as stated by many activists, that the herd immunity is just another word for mass murder. It is important to highlight that neoliberalism alone cannot explain that happening in Brazil. The federal strategy comes in the wake of the authoritarianism marking the history of the country, which anthropologist and historian Lilia Schwartz has summarized as our slavery past, the spectrum of colonialism, the structures of command and patriarchalism, the obstinate corruption, the racial discrimination, the manifestation of gender, sexual, and religious intolerance. This has never ceased, but rather taken on more incisive forms. For that matter, it is part of Brazilian authoritarian tradition, the omission to judge crimes committed by state officials during the military rule from 1964 and 1985. This is why we must always mention and directly address the objection that denouncing the federal strategy of spreading COVID-19 in Brazil is a form of activism, not science. Speaking only of failures of the federal government would mean maintaining neutrality or independence, as if you were discussing two sides of an electoral debate for or against Jair Bolsonaro. In fact, the issue of both sides is the subject of a broad debate in the field of transitional justice, which I want to go into here. But in my opinion, when it comes to serious human rights violations, the independence of an academic is expressed precisely by not sugarcoating scientific evidence, by stating objective truth, regardless of who the criminals are or their ideological position, even when they are still in power or remain influential. It is also worth mentioning that the concept of scientific evidence is in constant dispute, and denying the results of qualitative research is part of a much broader power struggle in the academic field. Curiously, the same academics quick changed their opinion when researchers from the global north acknowledged that we are dealing with a case of serious human rights violation. And only then, after external validation, do they begin to speak in the same terms. For all this reason, in fact, forgetting is militant. Forgetting is militant. Therefore, we must even briefly talk about the duty of memory. I refer to the famous definition by Paul Ricoeur. The duty of memory is the duty to do justice, true remembrance to another who is not myself. Le devoir de mémoire est le devoir de rendre justice par le souvenir à un autre que soi. In my understanding of this concept, the recognition of a duty is therefore a technique for connecting memory and justice. But we mustn't forget that this duty is never related to a single memory. There is individual memory and collective memory. According to Ricoeur, more than that, there are concurrent memories in each of these dimensions. memory that are in competition with each other. And there is history, especially official history, which often condemns some of these memories to subaltern lives. Speaking of the memory of COVID-19 involves telling the stories of the victims, recalling the institutional experience of the response, evoking lessons learned or not, and addressing the necessary fight against the political use of forgetfulness. The multiple stories of COVID-19 in Brazil are being told through various initiatives, including our SMAPL project. I bring to the context of COVID-19 what Bolivian sociologist Silvia Rivera Cusicanqui, referring to oral history, defined it as much more than just a participative or action research method where the researcher is the one who decides the orientation of the action and the modalities of participation. It is a collective exercise of de-alienation, both for the researcher and their interlocutor. For Cusicanqui, alienation is that which turns us into second-hand tributaries of conceptual and rational order that is foreign and hostile. The COVID-19 memory initiatives in Brazil today are varied, scattered, fragmented, and lacking due support. Many memory recovery initiatives are emerging in society, such as the films They Could Be Alive by the Mesquita brothers, and When the Air is Missing by Helena and Ana Peta, which give voice to family members of victims, healthcare professionals, citizens, and experts. The Ministry of Health has announced the creation of a COVID-19 memorial, which is a very important initiative, but what we truly need is a comprehensive memory policy. I refer here to memory policy in the sense attributed to it by the Chilean psychologist Maria José Reyes Andriani, which encompasses both public initiatives typical of political institutional realms aimed at disseminating or consolidating a specific interpretation of significant past events relevant to a country as a whole, as well as the articulation of tactical actions in public space that are part of everyday life. To preserve the memory of the victims of COVID-19 in Brazil, it's necessary to bring forth new documents, facts, and testimonies to create archives and make them accessible, to strengthen existing monuments and create new ones, to establish memorial dates and to organize exhibitions. It can render impunity unbearable and forgiveness impossible. Now, we need to talk about justice and reparation. There is no doubt about the intentionality behind the actions and omissions of the members of the federal government. The Parliamentary Commission of Inquiry into COVID-19 at the Federal Senate is the main accountability initiative that has taken place in Brazil to date. It was made possible thanks to footage from Manaus, the capital of Amazonas, which is one of the symbols of what happened in Brazil. On January 14 and 15, 2021, the lack of oxygen plunged the city health care system into chaos. In just 2 days, more than 6 people died in the state of Amazonas, and over 500 were transferred to hospitals in other states due to the shortage of oxygen. In the final report of the Commission inquiry of the Senate presented in October 2021 calls for indictment of more than 60 individuals, including the former president, former ministers, public officials, legislators, business people, doctors, and companies. The Commission confirmed that the delay in purchasing COVID vaccines was intentional and occurred by order of the president. Among the crimes identified by the Commission are charlatanism, spreading of epidemics, malfeasance, and in relation to indigenous peoples, crimes against humanity. Together with Cláudia Perrone Moisés and Kátia Martin-Chenu, we dedicate an article to the theme of crimes against humanity in the context of the COVID-19 in Brazil. Among the greatest failures of transition from the military regime of 1964 in Brazil is the absence of reforms capable of preventing the instrumentalization of state institutions by actors who cover up crimes committed during the military regime, as well the co-option of personnel from the media and the justice system, among other sectors. Recently, the attempted coup that occurred in Brazil brought the issue of amnesty back on the Brazilian political agenda. Regarding the crimes committed by those who invaded and vandalized the symbol of the Republic, the Praça dos Três Poderes in Brasília on January 8, 2023. The return of Luiz Inácio Lula da Silva to power cannot obscure the enormous strength of Bolsonarism and other strands of conservatism, including in parliament. In the case of COVID-19, there is no lack of attempts at criminal accountability from social entities, specialists, political parties, and parliament members, but these efforts have stalled due to a political blockade, as they depend on the actions of the Attorney General's office. During the COVID-19 pandemic, the Attorney General's office requested dismissal of cases against Bolsonaro and his ministers with outrageous arguments, such as the need for a list of all individuals hospitalized, proof of their direct contact with Bolsonaro, to establish his responsibility for the spread of the virus. In December 2023, there was a change in management at the Attorney General offices, and it was announced that the crimes related to COVID-19 would be investigated. However, to date, this office remains inert, clearly failing to fulfill its duty. Victim associations tirelessly fight for their cause, but without the due space and recognition. So, conclusion, the horizon for non-repetition. About the falling of the sky, the shaman Davi Kopenawa says, this has happened before. To say that something has happened before is the indigenous way of saying that it will happen again. During COVID-19, Brazil became a laboratory for what neoliberalism and populism, rooted in authoritarian tradition, and are capable of forging as response to the pandemic that will come. This experience has the potential to be replicated anywhere in the world. Public health tends to be converted into privileged sites to legitimize the annihilation of human beings at each new health crisis. This is why guarantees of non-repetition are so important. Based on memory, truth, justice, and reparation, We can think of institutional reforms and political movements capable of preventing massive violations. In the case of Brazil, there are many technical measures to adopt, such as implementing safeguards in legislation that block and strictly punish propaganda against public health when promoted by official bodies. But above all, we must build an institutional culture that considers what happened to be intolerable. Unfortunately, we are far from this. On the contrary, as a legacy of impunity regarding the crimes of COVID-19, the electoral use of health issues is increasingly employed, including the systematic attack on the mandatory children vaccination. The mechanism already experienced by transitional justice should be studied and discussed in the context of public health, both in the terms of ideas, so that the violations committed during COVID-19 are not separated from a broader context of the history of rights violation in Brazil, and instrumental terms, so that lessons can be drawn from this mechanism in order not to start from scratch and to avoid repeating preventable mistakes. I conclude by stating that the dialogue between the field of transitional justice and the response to COVID-19 pandemic in Brazil is highlighted by one of the most commonly used slogans in transitional justice. So that is not forgotten, so that is never happen again. With a thought full of memory, in the face of the new health crisis on the horizon, one must fight so that is not forgotten, so that is never happen again. Thank you very much.